To be honest, professional, I've actually always said don't ever do a facial.
Is it?
It's gonna be pink after. Your skin is so sensitive.
I know.
I can see, my goodness.
You can?
Yeah. Send them to your house. You made them bleed.
Really?
Yeah, for sure.
Your skin's looking better. Yeah, better. Yeah.
Better.
This is not good. Best results come to Bombay.
The best results come to Bombay.
Stop acting smart. Yeah.
I thought by this point you'd be relaxed, but it's okay.
Not at all.
So first thing we're going to do is to remove any eye makeup. Keep your eyes closed to me, please. Just hold it on for a few seconds. Often people come in with their sunscreens and their moisturisers on, which we want to remove. Don't forget they want to do the face and the neck, so we are going to be making our way down to the neck as well in this treatment. Now before this point, we have done the consultation and the patients know what to expect. Next step is oil melting cleansers. So a couple of pumps. You want to warm your hands up together and we make our way from the chin to the nose and then to the forehead. And this is where you basically start with the facial massage in order to increase blood flow to the skin.
But this is my first facial of my life.
Oh, I'm honored, yeah.
I'm honored too. Just after the facial also I should look like surgical.
Yeah. So then we're going to go in with our cupping. We are separating the layers of the skin because in this facial treatment, we are working on all the layers of the skin. How's that feel?
Good.
Good. So you feel a little bit of suction, but there should be no pain with this. Your skin is so sensitive.
I know.
I can see, my goodness.
You can?
Yeah.
It
It
looks
goes pink
great.
straight away.
I told you, she got pinky.
Oh.
It's true.
Okay, then the next step is we want to remove this with warm sponges. So the purpose of this treatment actually is to ensure that the skin always remains warm for the first half of the treatment, because we're going to be doing the chemical peel. Don't forget, with our glow chemical peel, it's activated with heat. Next, we're going in with the Micellar gel wash. Put 2 pumps into the bowl. Then you use the warm water so that even at this point, you are thinking about making sure you're keeping the skin nice and warm. Forms a beautiful froth like this. And the great thing about Micellar gel wash is it's loaded with humectants. I also put in tyrosinase inhibitors, which will brighten the skin. So after you've done this point, the skin should still feel very supple, like this. Okay, starting with the neck.
Vanita, this feels good. You spoil my habits.
You guys are more than welcome to come anytime.
I'm a simple man. He's not used to these treatments.
Oh, I'm going to remove this. So at this point, you can see the skin is supple, but also clean. This is the first base before we start applying actives to the skin. The next step is our hydrating toner. Now, after you've cleansed the skin, don't forget that you've changed the pH of the skin. The skin has become more alkali. You want to make the skin back to skin neutral. So keep your eyes closed for me, please. It's going to feel a little bit like a spray on the skin. So now I'm going to apply a serum to the skin. The purpose of this is actually the glow serum. It does a couple of things. Number one, it actually is a conductor for the radiofrequency that we're about to apply to the skin. And the beauty of radiofrequency is that it stimulates collagen, but it does it in a very gentle way. The second thing that I love about this professional grade serum is that I've loaded it with tyrosinase inhibitors simultaneously, but also we've put in collagen stimulating ingredients into it too. So this is what the radiofrequency device looks like, and you will feel it start to warm up on the skin. Whenever you touch the skin, you always ask how they feel. So it's going to feel nice and warm on the skin. Let me know. Is that okay? Okay, good. So this is radiofrequency. It's different to infrared. It goes deeper to stimulate the collagen. And usually, as we age, we start to see fine lines on the neck first before even the face. That's why it's a good idea to treat the neck simultaneously. Can't believe how pink your skin gets. Unbelievable.
Is it?
It's gonna be pink after.
Are koi mere bare mein? Your skin's looking better. Yeah, better. Yeah.
Better.
English is not good.
How's that feel?
Good.
Good. Feel feel nice and warm on the skin. And this does a twofold thing, basically. It's also going to be the base for our chemical peel. Increasing the temperature of the skin to 43 degrees Celsius, so it helps with the radio frequency and the chemical peel. You're actually going to see results from this just continue to happen over the next month. So you're going to actually see your jaw tightening. You're going to notice a sharper jawline. I'm just going to avoid the spot area. The skin's a bit inflamed there.
Do you think I'll recognize my after the same person?
I can see the bruising, I see.
Stop acting smart. Yeah.
Eyes closed, spritz on the skin. So now we are going to go in with the chemical peel, but don't forget you have to put your gloves on first. The chemical peel has been formulated for professional use only. There should be no pain with this. If you see an open wound, you don't actually apply it directly to that area, which is what we're doing here, is just avoiding any open skin because it's a broken skin barrier. And don't forget the lips as well. The lips are a beautiful area. It plumps up the lips and gets rid of any dead skin cells. Sorry, this does smell, by the way.
Yeah, it's got a weird smell.
It does stink. In here, I've put in kojic acid, lactic acid, mandelic acid, phytic acid, arylic acid. All those acids are great for getting rid of the top layer of dead skin, also stimulating collagen and also brightening the skin. Combined, they smell, and it's a fragrance-free. The whole brand is fragrance-free, so there's no chance of contact dermatitis. How's the skin feel?
Good.
Good. Now we're going in the warming tool because that's how you activate the chemical peel. How's that feel?
Good.
Good. I'm just going to move it for you in a second. It's nice and warm. It's going to feel a bit of a spray on the skin. So I'm now going to apply the Glow Serum. Now this is a microneedling, but this is just going to be a serum for now. Yeah? So I'm just going to apply. Sanjay, do you want to try the nano? Basically,
No, not at all.
Okay. I thought by this point you'd be relaxed, but it's okay.
That's what I'm trying to do.
We're doing fake bullets for you. We're giving the real stuff to Mahib. It's going to feel like prickly on the skin, but I'm going to ask you how you're feeling, and I'm going to tailor this to your skin. Okay? So we're going to start off very low at 0.1 and start with the neck. How's that feel? If you feel any pain at any time, you just let me know. This is 0.1, very mild. Like nothing. I want to slowly make my way up to 0.5, okay? Good, that's 0.3. Okay, I can see your skin's getting pink. I'm not going to do more than that for you. Next time you do treatment on any microneedling, you can make your way up to 0.4. Usually the jawbone tends to be a little bit more sensitive, but get really great results. You know, jowls happen with age.
Yeah.
So if you want to tighten that jawline, you need to stimulate collagen in that area, but the area tends to be quite sensitive. If I can do a little bit more, you're going to get better results. I'm just going to show you what 0.4 feels like. You okay? You know, my cousin, I also can't upset Anshu. Like, what did you do? Send them to your house. You made them bleed. Good? Well done, doing really well, really well. On the chin, I want you to get really good results here as well. You know, wherever you see scarring, because you know what will happen? This is the area you'll start to see a crease, right? This area here. And especially with age. So we want to focus on those marionette lines. It's called a controlled micro-injury. Actually, straight tomorrow, she'll start seeing results. But to get the best results, it's good.
Best results come to Bombay.
The best results come to Bombay. Like 6 weeks from now, she's going to notice a tighter jawline, skin smoother, and be wondering like, why is this happening? It's because we have one cell cycle that takes about 40 days. So stuff I'm doing to your cells right now, with the basal layer, you're not going to see for 40 days. Does that make sense?
Fab.
Skin is nice and pink. This is so good. It's so good. You're doing really well. Breathe. Take a deep breath. I'm just going to do the forehead, but you're pretty much almost done. Now, the forehead does tend to be a bit more sensitive, so I'm going to go a bit lower. And I'm also going to do the lips because I'm going to plump up those lips for you. Okay. How do you feel? Okay?
Okay.
This is 0.1 on the forehead. I can go a little bit deeper for you, but you don't actually have bad fine lines on the forehead, to be honest. Your forehead's a very good condition.
Yeah.
So I don't think you need to do much on the forehead.
I'm fine with this.
Okay, fine. I'll keep it at this then. So this sheet mask, I had to fly to Italy to go to an exhibition to figure out who basically can make me my own sheet mask with tyrosinase inhibitors for skin of color, because it didn't exist. This sheet mask I love. Like even the texture of it feels amazing. And fragrance-free. So whenever you buy a sheet mask, make sure it's fragrance-free. Because can you imagine occluding the skin with fragrance, which leads to contact dermatitis in 3 to 4% of the population. So for me, I get 1 million views a day on my skincare channels. So imagine if I tell people to wear a fragrance product, I'm burning 10,000 people a day through contact dermatitis. So avoid fragrance in all your skincare.
Okay.
It's gonna cool your skin down. So you are pink, but you're gonna get really nice results. So here we have our anti-inflammatory sheet mask, which is professional grade. I put in stem cells into this as well. So as you can see, it almost looks like a second skin. So now what we're doing is we're cooling the skin. So as you can see, the skin is quite pink. That means she's gonna get really beautiful results, but it does mean that we also want to calm it down so she's not so terrified as she leaves. But actually a little bit of pinkness is, you know, brilliant. And by tomorrow, the pinkness would have gone. So even if they get a little bit of bleeding, it will be gone by tomorrow. Skin of color microneedling technique is even different to how you microneedle on Caucasian skin. So for us, we want maximum benefit, but with minimum chances of irritation. So if you are a spa and you will be doing the Dr. V facial, I'll be teaching you how to do that. I'm just gonna cool your skin down a little bit, okay? The skin is literally drinking this up. Sanjay, how are you feeling? Oh my God, you look so relaxed. Mahiba's gone through like torture. Do you know what? I'm going to give you my InZincable, the body one. When you go to Thailand, put this one on your body, yeah? It's anti-inflammatory.
Oh, really?
It's anti-aging, yeah. Do you know about the different types of sunscreens?
Tell me.
So there's 2 types of sunscreen. Mineral sunscreen, which tends to be more expensive, but better for skin of color. And then we have chemical sunscreen, which you find on every single Boots, every single drugstore. The difference is chemical sunscreen goes into the bloodstream and it can irritate the skin and it can age the skin because often they put in denatured alcohol. So for anti-aging and brightening the skin of color, always opt for zinc oxide sunscreen, mineral sunscreen, right? That's the difference, mineral versus chemical. The problem is mineral sunscreens are more expensive and they're very hard to get hold of. We created a mineral sunscreen with no white cast, which is the first ever. Usually they came out white on the skin. And we won the Vogue Awards for the first ever mineral sunscreen for dark skin.
Wow.
Darker skin, which is really exciting.
That's too good.
Oh, I'll give you a big bottle of that so you can take that as well. And I'll also give you collagen as well to take with you. It's going to be good for your skin.
That's too good.
I don't know how much stuff you can take though, Mahib. How big is your
Don't worry. You know I always manage with these things.
I'll load you up. Load up the boat. Are you okay? You're not stressed?
No.
Good.
Is Sanjay finished with his mileage?
He's chilling. Look at him. So on this treatment, basically worked on your dermis and your epidermis. So worked on all the layers of your skin.
So which treatment do you think is a must?
For what? For brightening, for anti-aging, or?
Anti-aging or brightening?
And which, for professional or over the counter?
Professional.
Professional.
And over the counter.
To be honest, professional, I've actually always said don't ever do a facial. Facials were never made for skin of color. Facials with steam are a mistake. Basically dries the skin. We've already got less ceramides, less fats in the skin. Our skin already dries out much quicker and looks dull quickly. We should not be steaming our skin. We should not be using extractions on our skin. So extractions is the second mistake that a lot of these facials make. And then
you should not.
steam is a mistake. Extractions are a mistake. Then you know that scrubbing they do on the skin? Mistake. Physical scrub should never be used on skin of color because it removes your living skin cells and your dead skin cells simultaneously. So that damages the skin barrier. And then on top of that, they use harsh acids like glycolic acid, which I don't like for skin of color. So actually, I always tell everyone don't do a facial. The only reason I made this facial is because it didn't exist. So for example, we've used a humidifier on you today, not steam. We haven't done any physical scrubbing on the skin. We used a chemical exfoliator, which gave you even removal of dead skin cells. There's no glycolic acid in this. There's no fragrance in any of this. So that doesn't exist. This facial just didn't exist. So when I went to South Africa, I did a lecture and I had 700 people at the lecture and a lot of them were aesthetic practitioners. And I was like, Dr. V, what are we supposed to do in our treatments, in our clinics? I didn't really have an answer, to be honest. And I said, you know what, let me go back and let me create the world's first facial for skin of color. So that's what I basically did. And so the aim is to get into 1,000 spas that are high-end spas in the next 12 months. I want this available globally within 12 months. My husband's so excited to get his home back.
Where is he?
My husband, he's run away. He doesn't like the limelight or anything. He's like hiding in the gym or something, the golf course. Do you guys golf or not really? No. It's such a lovely sport to do as you age, I think.
I play pickleball.
Oh, okay. Is that a big thing in India?
Yeah. I'm loving it.
Really?
Yeah, love it.
But as we age, we do need to do muscle mass, muscle work. I know it's hard. We've just done the Cera Moisturiser, then we go in with the InZincable, and they are done. They're going to look pink until about tomorrow, and then they're going to start seeing their results tomorrow, but actually it's going to continue to improve. This is the InZincable that I'm putting on the skin. That's your mineral SPF 50.
But this feels good.
Oh, good. I'm so glad. Well done, Mahib. You're a pleasure to do.
We did it.
Amazing.